There are lots of germs floating around this time of year. After last flu season, you probably don't want to take any chances. So how do you know if what you have is a cold or maybe something more serious like the flu? Melissa Morgan is here to help us tell the difference between the two. She is the Senior System-Wide Director for Infection Prevention and Sterile Processing at Cone Health. Good morning.
Good morning.
Everybody gets the more than just your average stuffy nose. And, you know, we think it might be the cold, we think it might be the flu. Give us some of the differences. Tell us what to watch for.
Sure. So the cold and the flu are both caused by respiratory viruses. And so oftentimes it's very difficult to tell the difference because the signs and symptoms are very, very similar. So you might have a cough, stuffy, runny nose, feel a headache, body aches. And how do you tell the difference? Well, the flu is actually more severe.
I think the severity thing, and a lot of times you're right in the middle of it when you realize this is more than any cold I've ever felt.
Absolutely. And so those symptoms are more severe. You have a tendency to feel weaker, more fatigued, and want to stay in the bed. And so we want you to really take that seriously and be very symptom sensitive, I guess is the word I'm looking for. So getting good rest, hydration, making sure you're taking over-counter medications to control fever and cough are all good measures.
And that's something you should do whether it's the cold or the flu, but the flu is something you really, I think you don't want to spread, and I think a lot of times we get, oh, it's just the sniffles, I'll go ahead and go to work. If you suspect it's the flu, it's even worse if you're spreading that around.
Right. So any virus, we would recommend that if you have a fever or cough that's severe and is hanging on, not to go around people. So if you can do things like good hand hygiene, because hand hygiene is the #1 way to prevent the spread of infection, but also getting your flu shot this time of year is critical. And if your symptoms are really strong, you know, you can meet or see your Cone Health Medical Group physician or at a Cone Health urgent care for symptom treatment.
You mentioned getting a flu shot. A lot of people would say it's after the first of the year, it's probably too late. Truthfully, it's never too late, but there's still a lot of flu season to go.
It is never too late to get your flu shot. Other than hand hygiene, it is the #1 way to prevent it. We can also do things like the Dracula sneeze.
Right.
So never into
I've
your
never heard it referred to as that, but that's a great way to look at it.
Absolutely. So that way you're coughing or sneezing into your arm and it doesn't spread, because on our hands we're touching buttons and doorknobs, and that's how we are spreading it to others.
Great advice. Thank you so much for coming in and telling us. And as she said, there's a lot of flu season yet to go. So we've got a lot to be watching out for.
Absolutely.
Hey, she's actually going to be joining us all week on House Call to make sure that you know what to do when the flu is going around in your family. You can find out more information, though, by going to conehealth.com/flu.
House Call on Fox 8 is sponsored by Cone Health.